Hello, I'm Ella Britchko, licensed speech-language pathologist. I am going to explain how to produce the S sound, the various mispronunciations of it, and how to most effectively use this program. The S sound is most frequently produced with the tongue tip in the alveolar ridge area. This is the hard bumpy area behind the two upper front teeth. It is a natural resting spot for the tongue and starting point for many sounds. Some people produce the S below the bottom front teeth. Either way is correct as long as a correct sounding S is produced. When a child does not produce a correct S sound, it is usually because they are saying it with a frontal lisp or a lateral lisp. The frontal lisp, also called an interdental lisp, is the most common of all lisps. So when a child produces the S sound, it sounds like a TH, for example, thing for sing. Visually, the tongue protrudes between the front teeth. Many young children have a frontal lisp which self-corrects by age 4.5 years. If a child still has a frontal lisp at 4.5 years, that's a good time to have his speech assessed. When a lateral lisp is produced, it is usually because the tongue is in the wrong place or the sides of the tongue are too low. This low position allows air to escape out the lateral or side portions of the mouth, either on one or both sides. Sometimes a lateral lisp is called a slushy S. This type of lisp is not developmental and will not be outgrown. A person with a nasal lisp has air escaping through the nasal passages when they are producing the sound. With an occluded lisp, one sound is substituted for another. For example, tarry for sorry. A speech-language pathologist will determine what type of misarticulation is being produced. The child may need to do some exercises to tone the lingual tongue muscles and lips and jaw. The child may also need to learn the correct placement for the tongue. Although frontal and lateral lisp disorders are different, the approach in this program will work for both lisp types. As a beginning exercise, the child will need to learn how to explode a T sound or say it very forcefully. It is best to do this in front of a mirror and to be sure that the tongue is not peeking out between their teeth. Once the child can do this, ask the child to say T, 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 T. Next, ask the child to say Tss, 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 Tss. Once this is accomplished, focus on final TS or TS words as a springboard to generate a correct S sound. This CT program focuses on the TS sound at the end of words in single words, phrases, and sentences. We need to put on the earphones so that the child can hear their own voice more dramatically so that it makes more of an impact and makes therapy more effective. In this way, they will be able to hear their own voice and learn to judge if they said the sound correctly. Be sure to adjust the volume control on the program so that the child can hear their own voice comfortably when they click on the mic. This program gives the child the opportunity to practice the words and then respond to a question. If the child doesn't know the answer, click on the picture and it will produce the required response. When the child is able to produce the TS sound for each single word, you can advance to the phrase level. When the child is able to produce the TS sound correctly at the phrase level with most of the words, you can advance to the sentence level. If the child doesn't say the word correctly, Cue the child to put the tongue on the spot behind the upper front teeth where it's bumpy. This program is not intended to replace any diagnosis and therapy provided by speech-language pathologists. Please follow their professional advice and recommendations regarding therapy and the use of this program. Our program is intended as a tool to reinforce effective learning and practice. My website features additional articulation games and is www.sayitbest.info. I welcome your feedback about current software products and other ideas about new software that you would like to see developed and produced. If you have any questions or comments, you may email me at contact@sayitbest.info.